Welcome to the Weiser Center for Prostate Cancer, a sanctuary for hope where you and your family can thrive, from diagnosis through treatment, with patient-centered care from our team of experts and the wisdom of advocates and former patients.
When a patient is diagnosed with prostate cancer, there can be a whole range of emotions. Some people, will find that they're feeling a bit of disbelief, anger, frustration, kind of the question, why me? And the partners may also be feeling this way as well.
And people begin to anticipate what might go well and what might go wrong. And when they think about what they might lose as a result of the illness and perhaps of the treatment, they begin the process of grieving and mourning. And that happens even before treatment begins. Some of the things that happen with surgery prostate cancer will be side effects. And the primary ones are urinary incontinence and sexual dysfunction, most primarily erectile dysfunction, but there may be some other issues that come up. And the first way of coping with that is asking as many questions as possible to learn not only what those side effects are and how they might manifest, but also how they're relevant to me, because they will occur partially depending on the person's age, overall health, pre-treatment function, and the extent of the disease. So asking questions is the first way of coping.
In these situations where there is, lack of bladder control and issues with erectile dysfunction, I will work with the partners and the patient to talk about and, bring into the open what their feelings are, and just being able to recognize that these are forms of grief and loss that they're experiencing, and that working together and being open with each other and having open communication are really important for them to get through this together.
Most men and their partners have really found that engaging in rehabilitation brings them back to themselves faster, better, and that they feel empowered by taking a role in getting better through their own activity. One of the things that we have learned both clinically in our experience, but also through research, that partners are very motivated for the most part to really be supportive and helpful to the patient as he goes through the treatment for prostate cancer. The partners should be aware, though, that there are certain ways in which the men have to do their own grieving and mourning. When a man experiences erectile dysfunction, oftentimes partners will say, look, penetration is not that important to me. We can have sex other ways and I can still be satisfied, and don't worry. And that is certainly important, if that's true. But the man grieves the loss of erectile function just as a part of his normal body experience, because men look at their erections throughout their life, and if they already don't have erectile dysfunction, this is going to be a shock to the system. And it's not just about sex. It's about how a man experiences himself as a whole person. So it's important for the partner not to overreact to the man's need to do that on his own and just support his own private or maybe shared grief in that domain.
As patients and their partners move through the process of first being diagnosed with cancer and then having to make a decision about treatment plans, once there is a plan in place, this is when there tends to be more hope.
Because we have support for the treatment phase, for the recovery phase, that is going to address not just these feelings, but also any kinds of losses that a person will experience and potential for regaining functionality and quality of life.